As someone involved with the development of scheduling software, Dave deBronkart is quite good about keeping his medical appointments, even when one concern, such as a sore shoulder, leads to quite another.
Turned out to be just ordinary rotator cuff disease. But in the process of getting that x-ray, they saw something else, which was a little shadow, not so little actually, in the lung right near that shoulder.
It's not unusual for patients to present that way who have advanced disease.
The workup showed that what it was very advanced kidney cancer that had spread all through my body.
It often is diagnosed too late. There aren't very good screening tests for kidney cancer.
My primary doctor had told me that the odds were not good. I mean, he hadn't been any more detailed than that. But there's this moment that I'll never forget where all he could do was say, go home and have a glass of wine with your wife. And when that's all your doctor can say, it's pretty sobering.
Dave did more than have that glass of wine with his wife. He immediately pored over every available resource he could find to educate himself about the disease. He learned from the shared experience of other kidney cancer patients, and he shared his own experience in an online journal.
By the time the journal started, I already knew what my odds were, which were extremely poor, and I knew what the recommended treatments were. I already knew that the best doctor in the Northeast was the one that I'd been referred to at Beth Israel Deaconess, and we pretty much had a treatment plan all laid out.
Dave would come to find that he would be under the care of not a doctor, but rather a group of dedicated caregivers.
We work as a large team, so every new patient that comes is often seen by more than one physician, more than one specialist.
We have regular meetings, weekly meetings, to go over patients' cases where there's as many as 20 different doctors in the room, all talking about this particular patient's problem.
Step one in Dave's journey was pretty clear. Remove the diseased kidney, but the traditional open version of surgery would have meant a 6 to 8 week recovery before Dave could begin life-saving drug therapy.
Because we see a large volume of these advanced kidney cancers, we're very good at removing these tumors laparoscopically, even very large ones which are starting to invade the surrounding structures. He went home in a couple of days after a very major kidney surgery, which was able to be done through several small incisions.
Soon after, Dave was able to start treatment with high doses of interleukin-2, a powerful drug which stimulated the growth of cancer-fighting cells in his immune system.
We have probably the largest program for that option outside of the National Cancer Institute in the country. So we have a lot of expertise in using immune therapies for kidney cancer, but we also offer a wide variety of clinical trials. Our goal is to improve outcomes for patients, so we offer patients either new treatments or combinations of old treatments that we hope will improve outcomes.
Dave's cancer responded remarkably to the treatment. He currently displays no sign of active disease. Finding time for periodic checkups is something he is more than happy to do.
Boy, how do you evaluate, being pulled back from the brink of death, right? My recovery has been so complete.
Dave feels two things aided in his recovery: his ability to connect to his healthcare providers through Beth Israel Deaconess's patient site, an online tool that allows patients to communicate directly with their doctors, and his decision to start a blog.
The result was that I felt much more like I had some sense of control or involvement or participation in what was going on.
Doctors McDermott and Wagner hope that there will be many other success stories. Already, advances in systemic and surgical techniques, such as cyberknife radiosurgery, offer even less invasive options.
We were the first center in New England to use this technology to treat small renal tumors. Very focused amounts of high-dose radiation to just the tumor volume, sparing the rest of the kidney and surrounding organs from energy or from damage.
I don't know where else I might have gotten a comparable treatment. I certainly know that I can't imagine it having gone any better than it did.